There are three main things that happen as we age. The first is that gravity takes effect and the face starts to migrate downward. The second thing is that our face deflates to some extent. It's not just the face falling, but it's also volume loss. And then third is the skin itself. The texture of the skin changes and we start to form lines and wrinkles and we get spots and different colors and things like that on our skin. And so anything that is restoring from an aging standpoint needs to address those things and to think about those things. Today we're talking about the facelift, and the facelift is primarily intended to address the gravity changes that happen with the aging process. The approach that I like to take is a comprehensive approach that really manages the cheek or the mid-face area, the lower face, which is the jowl, and the neck. And anything that doesn't address all three of those areas runs the risk of not really looking quite as natural because you're just fixing one area. If you've ever seen bad facelift scars, they tend to be spread and stretched and really visible with suture marks and spread scars, and that's because the skin was closed under tension. My approach is a deeper, kind of a deep plane type of a facelift, and then no tension on the skin closure. In terms of incisions for a facelift, if we're talking about more of a comprehensive facelift, the incision really needs to go around this hairline here, behind this cartilage to hide it, behind the ear, and into the hairline. Many facelifts have, they tout a short incision or tout an incision that ends at the earlobe. And that's great if you really are only trying to address the jowl, but if the neck is an issue, then the extended incision is very important and it heals very well and is difficult to see. This more extended full facelift that we're talking about doesn't really have a defined age range. It could be performed as young as someone in their early 40s or someone in their 80s. It really depends on each individual, the way that they're aging, and also the approach that the patient wants to take to the aging process. It's really most important that you just come in and have a visit, have a consultation, and I can evaluate your face specifically and also what your goals are, and then we can usually make a good decision from there. I feel very strongly that any cosmetic or plastic surgery should not be something that is immediately apparent. The person should not look like they had surgery, they should look like themselves. And I've had a lot of people come in and tell me, wow, I didn't expect that it was going to be this good. I didn't expect it to be this dramatic, but I still look like myself. I look like the person that I used to look like. And I think it's really important that the surgeon is able to help guide the patient into a direction of maybe they don't need anything at all. It's a balance of me listening to what the patient is concerned by, but also providing some kind of professional guidance in terms of what may actually not be a good thing to do. And so this surgery is not just about, you know, people, the way that people perceive you, but it's about the way that you perceive yourself. And I think facelift is one of those surgeries that can really make a dramatic difference in your overall self-perception and also the way that people see you. But in general, we're just trying to make that person be the best self that they can be and maximize their good qualities and their features.